Here at the School of Social Work, our students have a great deal of contact with individuals who are in the community, and in many ways we think of ourselves as educating social workers in the community for the community. So examples of the kinds of things that our students are engaged in and that we as social work faculty and social work researchers are engaged in has a great deal to do with helping the community with the problems it's experiencing, with the various constituencies in any given community group. We do a lot of work, for example, on preventing problems, for example, some of the childhood obesity difficulties that the country is facing. Our school and the Public Health Commission here in the city of Boston are working together on a project that's involved with the Blackstone community and probably with other area community service agencies to develop strategies for prevention and for intervention around this problem. Near and dear to my own heart is a project on hoarding problems, which the public is well aware of at this point. Working closely with me are faculty members Jordana Muroff and postdoctoral fellow Christiana Bradiotis. And we spend the bulk of our time developing and testing interventions for hoarding in the community, and also particularly working on community task forces and how they contribute to effective interventions for this rather complicated problem. We engage a lot of master's students who are getting their MSW in our work with these hoarding individuals, and those students are also engaged in the community mental health service organizations around the city where we are developing and testing some of the specific interventions for this problem. Another example of the sort of activity that the School of Social Work is engaged in is part of our Center for Addictions Research and Services, which is directed by Professor Lena Lundgren, and it engages several of our faculty, Professors Amodio Delgado, Luz Lopez, in work with community agencies in central Massachusetts and in other areas of the city involved in providing addiction services and evaluating how well those services are working for the populations of people who suffer from HIV and addictions issues, who also suffer from alcohol and other substance abuse. So that's an area where they also employ MSW students working with them on these projects, and represents, I think, another example of the type of research as well as community-based services that our students engage in. Essentially, our social work students who are getting their masters here are very much involved with well over 300 agencies and service organizations throughout the region and the city of Boston, providing services to those communities while learning clinical and community practice skills. It's one of the things that social work is best at, is working in the community and for the community.